What's up, everybody? We are in our first vlog of the new year, 2023. So welcome. We are discussing injuries that costed your fantasy football league to lose. We all participated in fantasy football here as a team this year, directed by Dr. D. He is our fantasy football fanatic, and so
Commissioner.
our commissioner.
And commissioner, yep.
So we'll introduce ourselves. Excuse me. I'm Dr. Janae Brown.
I'm Dr. Bay.
I'm Dr. D or Dr. Daisuke.
I'm Dr. Sandoval.
And we're 4 clinicians at Physical Therapy San Pedro. We're your injury experts. And today we're going to talk to you about fantasy football injuries. So Dr. D, tell us what excited you and about bringing this, or talking about this as a team, as a group.
Well, like everybody here knows, I love fantasy football. I've been playing for years, and people like me like to bring it to work. So that basically we're just surrounded by fantasy football all the time. So, and obviously because we're all injury experts here as 4 clinicians, and I thought it'd be interesting to talk about some of the injuries that have affected the leagues, affected the players. Obviously, at the end of it all, we're always concerned about some of these players because we see similar injuries in the clinic itself. But knowing what the injury is, the mechanism, and how long the general recovery takes, I think it would be very interesting to talk about so that next year you can start to figure out, okay, this guy's going to be out for a certain period of time. Maybe I shouldn't draft these players, so on and so forth. So we're going to go through injuries, what it is, mechanisms, recovery time.
Cool. Yeah. Awesome. Okay. So we're going to start with Dr. Bay, and she's going to talk us through the first common injury that we see or that we saw in fantasy football. So Dr. Bay, what are you going to talk to us about?
Yes, I'm going to be talking about the high ankle sprain today, which was definitely an injury that plagued my fantasy team. My top draft pick, Jonathan Taylor, didn't perform like last year. Very disappointing for me. It's okay. It's okay. So what the high ankle sprain is the anatomy of our ankle is we have our 2 lower leg bones, our tibia and the fibula, and they connect with our ankle and foot below it. The high ankle sprain is actually not at the ankle joint itself, but between those 2 shin bones. The connective tissue in between, the syndesmosis, is strained when our foot is jammed in a position where the toes are pointed up towards the head and out away from your midline. So in anatomy, we call that dorsiflexed and everted position of our ankle. This typically occurs when people are doing quick starts and stops, landing from jumps, twisting, turning, changes of direction. So now if you see normal ankle sprain versus high ankle sprain, what are you thinking for recovery times? A high ankle sprain will typically be a little bit longer than a normal ankle sprain when you're considering who's going to be on your roster for the week or who you're going to be dropping. The recovery depends on the grade. So if you're seeing a grade 1, that's more like a 3-week recovery. A grade up to grade 3, you could be looking more at like 6 months. Surgery is not too common on this. It can typically be conservatively treated. So that means a lot of physical therapy, gaining the range of motion back, lots of strength training, retraining the body's awareness in space through our jumping drills, which we call plyometrics, agility, quick feet, and sprint drills, of course.
Awesome. Thanks for that in-depth explanation of a high ankle sprain. That was great. I feel like I just went back to
so welcome.
school for a sec.
Yeah.
That was awesome. Okay, guys. So, was there anybody in particular? I know you talked about Jonathan Taylor, but is there anybody in particular that you were concerned about in fantasy football in terms
Another
of?
big one was Cooper Kupp.
Okay, and
right?
why? Why were you guys?
Because
Why
he was
it a
like the
concern?
man last year.
Yep.
Okay.
One of the best receivers from
Triple
last
crown.
year, and obviously
MVP,
started
wasn't
off
he?
this
Was
year
he
too.
MVP last
He
year?
was MVP last year.
See, I pay attention.
And did he have a good recovery? Normal recovery?
He was out. He's out for the season.
He's out for the season.
Yeah.
Why do you guys think he's out for the season?
I'm assuming
Because he didn't come to us.
That could be it too. Yeah.
He needed us.
But I don't know the grade of it. I didn't really look into it, but I'm assuming the timeline of his recovery I'm assuming he probably had a grade 2 or grade 3. It was the tail end of the season. They were already down as a team. There was really no point in putting him back in. So I'm assuming that was the reason why.
Don't
they
risk
took him out.
him.
Yeah,
Let him
yeah.
heal all the way for next year.
They want him for next year.
So would you guys agree with that decision? Was a smart decision?
Yes.
Yeah.
I agree.
Yeah,
Smart.
absolutely.
Yeah, those boys didn't
Yeah.
really show up as much as last year.
Yeah.
Well, yeah, they won last year, so
Is there anybody
Not nearly
that
as
Quite,
Yeah, not
quite
even close.
different this year.
is there anybody that you guys feel like got sent back too quick that had a high ankle sprain?
Not off the top of my head, I don't think so. I don't remember.
yeah, I can't.
Mac Jones also had a high ankle sprain early in the season.
Was that early?
Yeah, I think it was second week, something like that.
And then did he play well once he came back?
He did play well enough.
Very good.
Yeah. And I think he re-injured it though, right? Towards the tail end of the
I think he
season.
did.
I'm assuming.
Oh.
Yeah.
Maybe one more week could have helped him.
Yeah.
Potentially.
Interesting.
Yes.
Interesting how that works. Okay. We
Wow.
want to talk about anything else about ankle sprains before we move on?
I mean, as far as recovery goes, like Dr. Bay talked about, ankles, not all ankle sprains are created equal.
Yeah.
Right. So there's the common ankle sprain, which is at the ankle joint itself, and the high ankle sprain is drastically different. So, and the mechanism is obviously a little bit different too. So just because people say ankle sprain, it could mean different things, not just from football perspectives, but all other sports. So I think for us, for physical therapists, right, when people come in with ankle sprains, we have to just make sure which one is it, because that's going to drastically change how we treat
For
each
sure.
individual. So
Yeah.
Yeah.
It's important.
Yeah.
Yeah. Awesome. Any other thoughts? No? Cool. Okay, let's move on. We're going to talk about hamstring strains next,
Yes.
which is the second most common injury we saw this season. So, Dr. Sandoval, share with us a little bit about what a hamstring strain is and a little bit about what happened in relation to fantasy football.
Yeah, this injury is very near and dear to my heart because it really affected my team specifically.
Oh,
So the hamstrings are a muscle group that lie behind the thigh. They basically help with knee flexion, so bending your knee, and hip extension, which is straightening out your hips, basically. And there's a couple of other movements in there, but those are the primary movements, right? How someone injures them is, or how someone gets this injury is by potentially running too much or too quickly, right? In football, you really see it when someone's sprinting really quickly and they just go a little too aggressively or they haven't trained enough for that specific movement. There are different grades. Similar to a high ankle sprain, the recovery time is based off of the severity of the injury. It can be a couple days of recovery, or it can, really be 8 weeks or even longer than that, depending on how severe it is, really. I don't think surgeries are too common. I haven't really heard of too many people
Not
getting
as much,
surgeries
yeah.
for hamstring strains, but that could be a potential issue if it's really, that severe. To really be well and good to really have a full recovery, it can really take a couple of weeks, like 15 weeks or so. Really, you're going to want to focus on strength training, plyometrics again, and really, obviously, getting back to sprinting the right way, right? Kind of like what I was alluding to earlier, it's near and dear to my heart because I had Keenan Allen on my team, and then I subsequently traded him for Deebo Samuel, who
Another one.
also had a hamstring strain, and so that really kind of derailed my season. And we won't talk about the repercussions about my decision making, but
Or we could.
no, we can not.
Let's talk about it.
No, let's not talk about it.
Dr. Bay, she likes to,
I ended up in last place.
Yeah. Granted, none of us did great, but
Hey, I did nothing, and I don't know what place I ended up
It
in.
was horrible.
Close to last. Not quite.
close to last.
As the best of the worst.
Still not the last, though. So I don't know if my theory worked or not worked, but it probably didn't work. But
Yeah.
okay, so hamstring strains. What? So you talked about one athlete. What other? Was there anybody that you feel like was mismanaged? You guys feel like was mismanaged in this season in terms of hamstring strains, or went back too soon?
So actually, Keenan Allen went back too soon, and he
Okay.
re-injured his hamstring,
Okay.
and he had to come back out for
Okay.
another, I think it was like 2-3 weeks.
Do we know
Yeah.
what grade his hamstring strain was?
I don't remember off
Okay.
the top of my head.
Okay, but went back
yeah,
too soon.
He did go back too soon.
Mismanaged.
Yeah.
Okay, poor decision making. Is there anybody that went back and had a hamstring strain that you guys can think of that actually did well?
Deebo Samuel,
Yeah.
actually.
Yeah, he's balling out now. So
Yeah, he's
that was a
killing
very
it
successful
now.
recovery for
in
him.
the playoffs.
Yeah.
Cool. What do you guys think? What do you guys think are the keys to sort of a successful? I know this is a very big question, but the keys to a successful sort of return to sport. What matters?
Load management.
Okay.
I think, especially from injuries that typically happen in sprinting, managing the amount of obviously foot contacts, the amount of sprinting they do prior to returning to the sport starts to matter a lot more, because especially with these elite players, they're going to put them in as much as they can. So they just need to make sure that they can tolerate all that too, because they might just be in for one game and they might end up having to come out afterwards. So like Gus Edwards, I think, is a good example. From a different perspective, he had an ACL tear, came back. I think in the first game, he strained his hamstring.
Yep.
Got it.
So I think it's just the preparation for the demand at hand. It was just too much for what his body can handle at that point.
Yeah.
So he had to leave for, I think, like 1 or 2 weeks or so.
Yeah.
So it was minimal, but obviously as much as possible they want him in. But if they can't rely on him, and they end up having multiple hamstring injuries.
Yeah.
Yeah.
You talked a little bit about in the blog about a proper return to sprinting and running program too, and how important the hamstrings are in that process. And I think, do you guys feel like as physical therapists we do a good job of returning our patients back to sprinting safely and jogging safely, or do you think we're doing a good job with that, or do you think we're keeping that as a priority in terms of return?
Is it, you mean like us in general or PTs in general?
PTs in general.
I don't think we do.
Yeah.
I think we could do a lot better job.
Yeah.
Way better job.
Yeah.
I think people tend to add, strength training is always a must, plyometrics. To a certain point, I think people do a good job as therapists, but I think sprinting tends to get neglected a lot, mainly because I think people just don't know how to teach sprinting as well, or how to manage the load to it.
Yeah. Yeah.
So I think we can all definitely do a better job with that.
Yeah, and that's something that we all here, we all try to work together in returning a client back to sprinting and just do it safely. We've implemented different methods across us to ensure that, someone feels good when they return. But yeah, the hamstrings are definitely super important, right, with running. Okay. Anything about the hamstring strains? Anything you guys else you want to talk about? Recovery? Any other cases? We talked about some good, some bad. Anything we missed?
I
Do you
mean,
think people would want to know?
I strained my hamstring.
Recently?
Personal experience.
Last year, 2 years ago.
Okay.
Yeah,
Oh,
that's
yeah, I
exactly it. I was sprinting.
Okay.
I didn't warm up enough, and it was about 5 in the morning, I think. I think I was running 20s or 30s or something. And on my second or third rep, it just felt like someone just shot me in the back of the leg.
Oh wow.
And it just crumbled down at 5 o'clock in the morning. I had to crawl myself back home.
So many good decisions.
Oh, yeah. Oh, God, it was horrible.
Physical therapists get injured too.
But
Yeah.
I started my rehab day 0 immediately after it happened. Obviously, I was limited in a lot of things I could do. I couldn't really walk properly at that point either, but just found the hardest things that I can do well at that point. I worked on it and then just gradually progressed. And I think I was back sprinting again in, I would say, like a month and a half, 2 months or so. And then just got back into sprinting. I was diligent on warming up after that point.
Yeah.
And doing it a little bit later in the day, and still sprinting now. So
Cool.
yeah.
I would just say completing your rehab to the fullest, because the hamstrings are ones that I think, especially with our patients, but we also see it with the football players, that they can linger from year to year if you don't fully recover.
Yeah.
Yeah.
It's true.
Absolutely.
I think
Yeah.
Kadarius Toney was a good example. I think
Yeah.
he strained his hamstring about 6 or 7 times this year.
There
so,
you go.
Yeah, I think he's a very good example of that.
And Keenan has a history of hamstring strains too. Keeps coming back.
Yep.
Yeah, they are one that, the thing about injuries, all these injuries, is that once you're injured somewhere, you have to properly, right, manage it and make sure it doesn't come back. So it's, an injury that was there can possibly return in some different way. You're already prone a little bit.
Right.
So, and it takes time to heal, really a good amount of time to heal any injury long term, right? So, so you just gotta be smart, right?
Yep.
Okay, I'm going to talk about concussions. That's our third sort of injury that happened commonly in the fantasy football season this year. And so concussions, and I'm a concussion specialist here. Dr. Sandoval is actually undergoing a concussion specialty right now. So he is going to be sort of my backup, which I'm super excited about. But I've been treating concussions for about 5 years now. So, and seen a lot of different types of concussions. So I'm going to try to be really concise and about this because concussions are very complex. It's a very complex injury. But essentially, we used to think that a concussion was sort of a brain injury. Like, so if the brain hit the front of the skull, that it would bruise and sort of we have had a concussion. So, but now we know from research that a concussion is essentially basically a stretching of the fibers in the brain, okay? And so when a person gets a concussion, it's a momentary sort of thing. It's an excitatory phase in the brain where the brain thinks it's getting a lot of messages at once, but it's actually getting no messages. So the problem isn't really the concussion. The problem is what happens sort of after the concussion. Post the concussion, a few days post the concussion, we go into what it's called a spreading depression phase. And basically, in the body, ATP is depleted about 20% because it's sort of going to help heal the injury in the body, okay, in the brain. And so basically during that time, you have 3 to 5 days after concussion where you're tired and you have an increase in these concussion symptoms. Now, there's 20 concussion symptoms, and everybody doesn't get all of them. And you guys have probably heard of some of these: headache, fatigue, nausea, loss of balance, loss of vision, or changes in vision. There's a lot of them. But basically, during that time, we're in sort of our a scary time in the brain because we have very low energy in the body. We have all these symptoms, and it's really important that we kind of do some active rest, okay? Most people between about 7 to day 10, their symptoms are kind of resolved. And we see that in a huge amount of the population. But metabolic recovery doesn't really happen until about day 22 to 30 based on the research. So what happens a lot is people go back to sport when their symptoms are gone, but their brain isn't actually healed. And the problem with that is that if someone gets a concussion anywhere before day 22 again, then they're at risk for increased prolonged sort of symptoms, which could be anywhere from 90 to 120 days because of sort of this cumulative effect that happens from another concussion. Or they can be at risk for like a severe traumatic brain injury or permanent damage. So with moderate brain injury and with severe brain injury, ATP, which is our energy molecule, that energy level is usually depleted 50%. And so you'll see those injuries actually on an MRI or a CT scan, but you won't actually see a concussion on any imaging because of the low amount of energy that is sort of depleted. So concussion can be healed properly when it's managed properly. The issue with most concussions is if they're not managed properly, then we can see prolonged symptoms, okay? And I'll be honest, in the last 5 years that I've treated concussions, I have returned every person that I've seen back to function, back to sport, who has come to me within the first week or two. Or even I've gotten people towards 30 days and I've seen them. But if they get to me late, and if they return to sport within the first week or two, most of those patients that I have still have prolonged symptoms. So it's really important that it's managed properly by a clinician who treats concussions and rehabs concussions frequently and understands them, because the problem with a lot of this stuff is we have people making decisions, even in the NFL and NBA, MLB, that are not properly trained, that are not concussion specialists. And so they're sending our athletes back, too quick. So, or they're, depending on the injury, depending on your level of, I don't say importance, but I mean, if this is your career, right? Then, it's really managed tightly, and they're really trying to get these athletes back, quick when they're really not ready. So I personally did not follow fantasy football too closely, but I do know about a couple of injuries that happened. But let's talk together about sort of some of the concussions that happened in this season and whether you guys feel like they were properly managed or poorly managed. So we can shoot out anybody, but you guys tell me what your thoughts are.
I think the easiest one to talk about is Tua.
Okay.
Yeah.
Okay. So why was he improperly managed?
I think the first one that we know of is during one of the games. He obviously got tackled, had a concussion. Had a little bit of loss of balance as well. Came out of the game, went back to the locker room. Supposedly, he got cleared by the physician. I don't know. I think it was the team physician.
Are you talking about the one where they called it a back injury?
I think so. I can't remember which one it was. But then he came back into that same game.
Yeah,
Okay.
that's
Yeah.
that game.
Yeah,
That's
and
a
then
no-no.
he got another concussion. And after the game, basically, they said it was a back injury. Clearly, it wasn't. And then he had the next game. I think that game was on Sunday. The next game was on Thursday.
Oh, that
on
was the
4
bad
days.
one.
Yeah, that was the bad one. He got another concussion, and basically that would be considered second impact, right?
Yes, but
A little
Probably
different.
third, probably. He could
Yeah,
be a third
third.
concussion.
technically third.
Yeah, and at that point, he had to get sent to the hospital immediately.
Yeah.
So
And
poorly
where's
mismanaged.
yeah, and so like currently, well, my understanding is like so if you're on the field, if you're on the sideline, if anybody has any one of those 22 or 20 symptoms, I would not let them play again, right? In a youth athlete, college, anybody that it wasn't a big game. But then you go to the fact that it's a big game or it's an important game, and we're making different decisions, right? So probably the athlete, what they're saying is going on, there's probably a lot of different opinions making those decisions of sending someone back in or not on the back end. Probably the coach drives that, a lot of that decision making. But a lot of times our athletes are like, no, I'm fine. And I think that's the hard part too, is that you sometimes have to make the decision for the athlete. Yeah, you might feel fine, but you're not going back in. You know what I mean? So we don't really, do you guys know any of the background of that on the decision making? Did they talk about it at all? Like how he ended up going back in, or is it kind of like no one said anything?
Well, that same day, they didn't think that it was a concussion. They just thought that it was something else. But,
Yeah.
If you watch the replay, you clearly see that he does hit his head. And when he gets back up, he is stumbling around quite
Yeah.
a bit, and he couldn't control himself. Then the
Yeah.
level of play that he has after he hits his head is,
declined.
poor.
Yeah.
I will say, though, with him, I will commend him because he later on in the season did self-report for concussion symptoms after a game, and so he hasn't been playing, or I guess now the team is out of the playoffs, but he hasn't played towards the end of the season because he did self-report for concussion symptoms, so he has been in concussion protocol for the past, I think, month or so.
Got it. I'd love to sit down with him and talk because
Yeah.
I would love to know if he ever got rid of any. Like he probably has ongoing symptoms
Yeah.
that are probably never going to go
Yeah.
away.
Yeah.
That's the reality.
Basically, in the last game he was playing, he got another concussion. That was the reason why he got called out.
Yeah.
But after he was talking to his head coach and he was watching footage and he couldn't remember some of the plays that he actually did. So
Wow, that's scary. And then that like would be sort of permanent, sort of, to me, more sort of permanent brain damage when you're getting into those phases. Yeah, it's very interesting. The brain is something you don't want to mess with. I don't care what level you're at, but I'm like, take 30 days. Take 22 days. That's what our research
He came
said. Take
back after
22.
the first head injury 4 days later. Like
Yes.
his next game was 4 days later, and that's
Yeah.
not okay by
Yeah.
any means.
Yeah. The problem is too, like I said, it's all the level of what people know. There's certain people who know a lot of this research. There's people who are not following it. It's new stuff. But I feel like if any injury we're going to protect, the brain, you don't get it back. You don't get those things back. So, yeah. Anything else you guys want? Did anybody have a concussion and have a good return to sport and good decision making made for them that you guys can think of? Did anything happen after that, like where they learned from that experience and they didn't do that again?
I don't remember any this year.
No.
I mean, there's a lot of concussions that happen that come
Yeah.
back in like 1 or 2 games. So
Yeah.
I'm sure there's plenty. I think like Joe Mixon had one. A lot of running backs end up having them. But I would say majority of them end up coming back.
Yeah.
Yeah, fully.
Yeah.
His was just an anomaly, I
Yeah.
would say.
Yeah.
Hopefully.
Hopefully, yeah. they said he's coming back. So
Yeah, what you hope is that they sort of they learn from it, right? And they
Yes.
make better decisions and make better protocols go into place. Because people like me are like screaming, like,
I know. There's been
put
a
him
lot of
back in.
changes in the rules, right, to help reduce the occurrence of concussions, but they're still hugely prevalent.
Yeah.
Yeah.
Yeah, you really can't, like I said, you can't change that a concussion is going to happen. You can only change how you manage it, right? And
Right.
so it's not they're going to get concussions. They're dealing with high forces, to the body and to the brain. And the concussion could be fine after if you just manage it correctly.
Right.
So cool. Okay, let's move on. Last injury we're going to talk about is ACL tears.
Yep.
And Dr. D is going to take us through ACL.
So you probably hear this all the time with actually almost every sport for the most part: soccer, football, basketball. ACL is basically one of the major ligaments in the knee that creates stability there. Majority of the time, I would say the mechanism of it is when you're planting, cutting, sprinting, changing directions, jumping. So majority of the time, it's when you're planting your foot on the ground. It does sometimes happen with direct contact to the knee as well, but I would say it's less common for the most part with these types of sports. Recovery time is, I would say, roughly around 9 to 12 months for return to sport. So there's a lot of research saying that anytime before 9 months, there's a higher risk of re-injury. So, and it drastically changes within that timeline. So majority of the time, they do try to wait it out at least till about a year, but I would say even though they're professional athletes, they have all the resources for rehab, they feel about 100% in 2 years.
Yeah.
So they're already playing at that point, right? About a year out, they're playing already. But after about 2 years, they're like, yeah, I feel about 100% now. Like I feel like my strength is back to where it was. My agility is back to where it was. So it's a long process from a healing standpoint, but from a strength training standpoint, plyometrics, sprinting, all the other stuff that kind of comes into play. But sometimes people come back to play a little early, and there's ridiculous people like Adrian Peterson where he comes back in, I think, like 8 months or something.
I thought it was like 6.
Was it
something
6
that.
months?
Yeah, I think it was 6.
And he was just amazing coming back. But again, he's the anomaly. As far as clinicians go, we try to push it out to at least 9 months when it comes to return to sport, return to play, because they're going to be returned to sport probably by then. But as far as notable players, as far as like Kyler Murray, Breece Hall, for the most part, when it comes to these ACL tears compared to some of the injuries that you guys talked about, they don't come back during the season, right? Because the first step is usually having the ACL reconstruction done, and from then on, it's 9 months.
Yeah.
So the season is over by then.
So would you draft someone the next season who had an ACL tear?
If
question.
if it happens early on in the season,
Okay.
there's potential for them
Like
to come back.
preseason.
That's what I would
Yes.
talk to my friends about.
Yeah.
They're like asking
Yeah.
me.
So that's one of the things you do research on before the season starts is, okay, when did they have the ACL reconstruction done? And how is their rehab going too,
Yeah.
right? Because sometimes it just takes a lot longer for some people.
Yeah.
It might end up taking 15 months for some people, and
Yeah.
they just don't feel like they're ready for it. So
Yeah.
going into it, like Kyler Murray, his was pretty late in the season, so he's probably not going to be coming back till probably next November, December, potentially.
Thanksgiving.
Yeah.
So it takes a little bit longer for them, but he might be another Adrian Peterson potentially.
Potentially.
But obviously they don't want to risk that either. So
Yeah.
yeah,
So I wish they treated concussions like they do ACL tears, where they just say you just know, even if they didn't have surgery, right? And most professional athletes are going to go into surgery, right? Even though we do know the research shows that there's not much difference between conservative management and surgical management right now. Like the research, it's very inconclusive on whether one is more successful than the other, but it doesn't matter. Right now, the protocol is like ACL tear surgery, right? It'd be great if they implemented just, you have any symptom, that's how it should be. You're out for 22 days. Like, I don't care. Like, and you need to pass all the tests and whatever. So hopefully that happens in the near future. But with ACLs, I think one thing that's really important that I think, our followers, because most of them, well, maybe a small percentage are professional athletes, but a lot of people are the average college, high school, youth, whatever kind of athlete. An ACL management protocol for you is going to look very different from, like you said, for a professional athlete. They're getting daily. I mean, their life is this ACL tear. So everything every day is surrounded around rehab, right? For you, you come in to see us 3 times a week, 2 times a week, maybe once a week. So, so it's different because the amount of time goes probably longer a little bit because it's not getting managed as aggressively, shall we say, right? And ACLs are time-based, right? I mean, the research we have right now, we use time-based methods. Even when they meet all their protocols, sometimes we still use time because the research shows us right now that time is a huge factor.
Yep.
And right now that's that 9 to 12 month range to return to sport. So yeah. Anything else you guys want to chat on ACLs? No? I think we killed that one.
An
Yeah, that's good.
example, I guess, would be like Odell Beckham Jr. because he tore his ACL at the Super Bowl last year and he still isn't back.
Oh, wow.
And so that's one of those examples of where
That's a
it can
long
take
time.
a little bit
Longer.
than the 9 months.
Yeah. Okay, guys. So we talked about 4 injuries: ankle sprains, hamstring strains, concussions, and ACL tears. 4 common injuries that we see a lot of, and that you probably saw a lot of in this fantasy football league. Dr. D, do you want to end us off on anything that you feel like we could pull that all together for our followers, listeners? Anything that you feel like they would need to know?
Well, you can kind of tell from what we all talked about for at least these 4 injuries, physical therapy plays a big part in all of them. So don't try to manage it yourself. You're definitely going to need help, especially if you don't have a background in it. So that's why we exist in the first place. We're here to help you guys out. So obviously we have 2 concussion people, and we all treat orthopedic injuries. So if you guys have any of these injuries or need help with it, we're here for you guys.
Yeah, absolutely. Anything other thoughts you guys have? Spawn off of Dr. D?
Thank you for setting up the league. That was a lot of
Yeah.
fun. Even though I got last
I'm going to
place.
be more involved next year, I promise. It's going to
Okay.
be a new year. I'm going to actually make changes
We can watch
and
this
follow
back.
it. Yeah.
So you said.
Okay, guys. Well, thanks for listening into our blog and tuning in to our discussion. You can find this blog fully written by Dr. D on our website at www.physicaltherapysanpedro.com. If you got an injury, send us a message. If you need some help with something, reach out. We got you. We can treat you in person, or we can treat you virtually via telehealth. So we love helping people get back to sports, back to the things they love to do. So reach out to us. You can follow us on Instagram, Facebook. We're going to be heavily on YouTube soon. That's what we're working on. And you'll find more of these podcasts as well, because we're going to have a podcast set up. So I think that's it. Thank you guys for tuning in. Bye.
Bye.